And we weren't included in the pay rise either. So we stand clear and shoulder to shoulder with the NHS workers today to demand a pay rise. I was really happy to see the Equalities block here today because there's a lot of inequality that is happening within access to healthcare in our society. We've seen that there's been systematic discrimination of frontline healthcare workers who've said there's been a lot of people who've been saying that they've been forced to work in the red COVID wards while their white counterparts have been working in green wards. Obviously we know that all NHS workers have been clubbing together to fight this, but it's easy to see if you look at the pictures of the people who've died that there's disproportionate numbers of black healthcare workers who have died fighting the front lines of COVID-19. BME NHS staff who died in England the numbers were 7 times higher than white NHS workers. That was a report done in May. And there's also this ethnic pay gap where white consultants can earn around £4,000 more than BME consultants. And all of these things we need to be talking about. So I'm really happy to see the Equalities Block, the North East Against Racism, the Migration Forum, the Anti-Racism Protest Defence Campaign, Fight Racism, Fight Imperialism, all joining an Equalities Block talking about these issues. And then we've got Brexit coming up, where international nurses, even with the reduction in the amounts of money that they'll have to earn, they've been told that they have to earn £20,000 in order to be granted a Tier 2 visa. Let's face it, millions of NHS and social care staff are paid less than that. I know I am. How many people are going to face deportation and are going to be forced, they're not going to be able to get their visas as a result? Exactly, no borders, no nations, no borders in the NHS. And then we've got the immigration health surcharges, where £400 per person is expected to be paid if you want to access the NHS services if you're a migrant. £400, not per family, but for each individual person, so babies and children, if they want to access the NHS, or a migrant family, they need to pay £400 per person. I know there was a lot said about scrapping it for certain workers. That actually hasn't happened yet. People are demanding refunds because they've still been told they have to pay this surcharge. And they're talking about increasing it to £625 per person. That means a lot of people just actually can't afford NHS care. And this is supposed to be a universal, free and point of access service for all. And I know that all the healthcare workers who fight and work for the NHS are determined to keep it free, universal access for all. Anything else is privatisation by the back door. Anything else is introducing a two-tier system to healthcare. So it's good to see that the fight against racism is here. It's been talked about in the fight for the NHS because we know that we need to defend a free NHS service access for all. But one of the problems in terms of organising against racism in Newcastle at the moment, that the police have been repeatedly banning anti-racist protests. And they've been singling out young black and Asian men for arrest for their participation on Black Lives Matter protests and also socialist activists. There's a defence campaign set up, there's a stall at the back, take a leaflet, sign a petition. We need to defend anybody who comes out to speak out against racism, whether it's inequality within access to healthcare or pay gaps, or whether it's Black Lives Matter on the streets. So please take a leaflet and support the people who have been arrested and face charges and defend the right to protest against racism here in Newcastle. Fight for the NHS, free access to healthcare for all. What do we want?